Top of the morning, Dan, and in for Amy J this morning, former state rep, congressional and gubernatorial candidate Jeannie Ives, now the principal at breakthrough-ideas.com, a political and policy messaging shop. Programming note, bottom of the 7 o'clock hour, we will return. We spent the last hour talking about the officer murdered, the other officer critically injured on Saturday night at West Inglewood. We will return to that topic at 7:30. Now we need to cover a little bit on COVID. And, Jeannie, it's interesting to me to note in Florida, where Governor DeSantis has barred mask mandates, at least four Florida school districts defied DeSantis by imposing their own mask mandates. Now, forgetting which side of this you're on for a second. So tell me again, Catholic and private schools in Illinois, how your hands are tied, you're just following orders, it's not your decision, implying you actually disagree with the decision, which I don't think they do. So the folding into the state by the faithful, at least the leadership of the schools of the faithful in this state, an underreported scandal in my mind, and what a massive missed opportunity being inflicted on schools by their leadership that have served so many kids so well for so many years.
Well, and here's the other part of this. Remember, Illinois private school parents, how you finally, towards the end of the fight, got involved and helped sign thousands of witness slips opposing HB 2789, which was essentially the IDPH and Illinois State Board of Education taking over your private school in the case of a health emergency. And, we got the fight in, and like all these schools are emailing their parents, tell your legislator we're not going to put up with this. You just capitulated to them. You just all that fight in May was for nothing then?
Right, we don't need the legislation. Well, but you defeated the legislation. Okay, well, congratulations. Now we'll do it by executive order, and we'll have all of your school's leadership teams comply.
Yeah, exactly. So, I mean, this is a huge issue with the private school parents that I've talked to. Public school parents are upset as well. I mean, this is ridiculous. And, I told you last night, Dan, I had to sign my daughter up for cross country. I'm always like last minute here. And so I'm like, okay, I'll sign her up. I go through this whole parent consent for participation waiver and release. And of course, there it is right there. I had to waive everything. I further acknowledge that my child could be exposed to someone who may be incubating communicable illnesses or other diseases, including but not limited to COVID-19, coronavirus in parentheses, and who may be capable of spreading disease to others during participation. Here you go. Here's the waiver. Here's the waiver for her to go cross-country outside. Okay. Well, I don't know why we can't do this everywhere.
Well, there was a little bit of a slideshow presentation in Orland Park at the last board meeting. Keith Pekau is the mayor there, and he's the best Republican executive official in elective office in the state. Maybe the best Republican elective office in the state, just generally speaking. I
echo that.
I think you'd be hard pressed to find somebody better. And he just presents the data. Man of data and science, the mayor of Orland Park, against all of the ersatz men and women of science and all the other elective offices in the city and the state. Let's talk about, and by the way, I got the PowerPoint. He shares it. All it is using IDPH and CDC data against the arguments that are being made by IDPH and CDC. Cases and daily deaths. Let's talk about it.
So this is the cases since the beginning of April of last year. You'll see that you see a spike on the left-hand side. That was our first wave. Now, it's so low because we had no testing back then, if you recall. So the cases are, as anyone would probably tell you, the cases were higher than the one at the end of the year when we had a lot of testing because we had no testing. So you had a spike, you had another spike. Then we actually had a third surge in April, May. You see that little hump? And now we are actually in the middle of a fourth surge. You see how much lower that surge is? So this mimics a lot of things in nature and in science, the dampening of vibration in a bridge, flutter in an airplane wing. You throw a ball up and bounce, you'll see the same kind of graph. Anyone who's had some basic science have seen these kinds of graphs before,
Right,
and that's exactly what's happening here. This is a virus running its cycles. Okay, so it's a forced surge. It's less than the others, and like I said, we're well into it. It is also much less impactful. For example, what we were told yesterday in Chicago, the deaths per day on the first surge was 50 a day, then it was 25 a day in the second surge. Third surge, it was 7 a day, and now it's 1 a day.
That you look at the cases, I'm looking at the slide, this is IDPH data.
Yep.
They were running 7-day average 15,000 in November, December of last year. They were running about 4,000 April, March, April, May, as you went from March up to April, and then it started to slide in May, and crater in June. And now it's ticked up a little bit to just under 2,000. And yet we're treating it like we're back in the area we didn't know a year and a half ago, or the peak the end of last year.
But Dan, it's the Delta variant. It's that scary sounding Delta variant.
Mm-hmm.
You know.
No, I've heard all about
Mm-hmm.
it. From 50 a day to 25 to 7 to 1. And the response is the same because of this sort of post hoc ergo propter hoc argumentation you get from these charlatans in office. Wet sidewalks cause rain. The mitigation approach is what's reduced from 50 to 25 to 7 to 1. No. And there's no evidence to support it, starting with mask wearing, particularly for kids, and we'll get to that in a second. But just more data here locally
Mm-hmm.
that you hopefully can use among your peers to bring those who are on a ledge back into safety and sanity. Hospitalizations.
For example, here locally, with 2 Silver Cross and Payless Hospital, there's 1 person in the ICU bed in each with COVID. That's it. And even yesterday in our mayor's caucus briefing, the hospitals are not at risk. No one's saying that they are at risk. So the question is, if this was all done, these mitigation factors were all to keep the hospitals from being at risk, and the hospitals aren't at risk, why are we taking more mitigation measures?
I'm just going to wait for JB to set up McCormick Place as an auxiliary hospital again
Right.
and spend $67 million for 36 patients or something like that. I mean, why is that not happening if they're so worried about this? We're right back to this is deja vu. This is Groundhog Day for parents in August before school starts.
And again, I know the majority of parents are public school parents, government school parents, but I mean, particularly the private schools, and my particular interest, the Catholic schools. What the hell are you doing? Do you not see a missed opportunity? You think because you've got waiting lists right now, you're going to have waiting lists in perpetuity? This is the time to promote and expand and bring in people. It doesn't matter if they're Catholic or not, because again, Monsignor Michael Boland,
right.
We educate people because we're Catholic, not because they are. This is such an opportunity. And what are you doing? You're folding in with the state in the most dulcetory, groveling sort of way, and you're covering it all in the same rhetoric of the most craven politicians in the state and country. So let's talk about the mask mandate and hospitalizations. Keith Pekau.
Flip to the next slide. Now, we've been hearing for over a month that this variant and everything is about kids, and kids are hospitalized at a higher rate, and kids are driving this, and kids and kids and kids. We've made the kids the boogeyman here, okay? And culminating by Wednesday, we have a mask mandate for schools. Nowhere else, not at Guaranteed Rate Field, not at Lollapalooza for sure, not at United Center. I was inside the United Center for concert. None of those places. Nowhere else, not here, nowhere else have we had one. Here's the truth. This is from the Cook County website. From 6/29 through August 5th, so 37 days, this is the amount of cases and the amount of hospitalizations by age. It doesn't look to me like that's being driven by kids who are under 20. I think it speaks for itself. Flip to the next slide. So over the last 37 days, if you look at it on a rate basis, so per 100,000 population, the case rate for children is half of the next highest group. It's 70 to 79 or 12 times higher. Hospitalization rates, 2 per 100,000 for kids, and going up the line, up to almost 80 for people who are over 80.
2 per 100,000 for kids. Nationally, the CDC reported for the week of July 30th, the rate of hospitalization with COVID for children 5 to 17 was 0.5 per million, which would amount to roughly 25 patients nationally in a country of 330 million people.
Well, that's because the masks work, Dan, and they've been wearing their mask.
I just want you to hear one more from the Orland Park Village Board meeting. So the mayor there, Keith Pekau, by the way, Air Force. Mm-hmm. So you start to understand why you have sanity there. But Barb Ketchy, she's a preschool teacher there locally. She just went through this whole presentation with the data from IDPH, from CDC, in context. And here's what you get from a local preschool teacher.
Preschool to grade 5 public school right down the road. We wore a mask all year. I actually wore 2 masks all year. I didn't miss a day of school.
Therefore, masks work.
And actually, we had a hugely successful school year. The kids were happy. No one ever complained, not a single child. I teach in the preschool ages 3 to 5. No one complained. All the other kids came in as happy as could be every single day. So I was actually relieved to hear that I had to wear a mask this school year, because I've got coworkers that are recovering from breast cancer. I've got coworkers that have autoimmune disorders. I've got coworkers that are going home to their husbands who are recovering from cancer treatment, that are in cancer treatment. So I'm just going to say, from my own experience working at District 118 every single day, I didn't miss a day of school. The children never complained, not once. The parents, yeah, they were belly aching, but not many. So actually, we had a very successful, awesome school year.
The 3 to 5-year-olds weren't speaking up for themselves. Everybody was happy as far as Miss Catchy saw it. And there were a few parents belly aching, which she obviously takes their concerns very seriously to describe it that way.
Yeah, these are the people educating your kid, and I'm tired of it, quite frankly, because we know masks don't work. Multiple articles about it, and in fact, we know masks are harmful. And I mean. So I'm tired of the lie, right? I don't want to send my daughter to school because I don't want her to participate in the fraud of a mask. Now, she's a senior in high school. We're probably going to, unfortunately, end up sending her because she wants to do it. But, you know, she's a senior, right? Here's what's going to happen, Dan. 2 weeks in, those masks are going to be hanging every single way that you can do it. And all they're going to try and do is police masks. But these little kids, the ones that are really affected, the ones whose parents tighten them on their face, so it's like up to the bridge of their nose and covering them completely. I don't know. To me, that's abusive. That's absolute child abuse to do it that way. They don't work. It's ridiculous. And you know what? Out of the mouths of babes, I think, are where we're going to do it. Like, I want a precocious child to say to their teacher, you know, how come I have to wear a mask? I just had a sleepover birthday party with 8 friends. We stayed up late playing video games, sitting on the couch next to each other. And how come COVID isn't in my basement?
Well, look, Teach, if you and your extended family are so concerned, then as far as I understand it from the CDC, go get vaccinated because it prevents serious illness, much less anything worse than serious illness. So what's the problem? Also this, I mean, these Dr. Marty Macri, you know, Johns Hopkins School of Medicine, Dr. Cody Meissner, Chief of Pediatric Infectious Disease at Tufts Children's Hospital. You know, a couple of right-wing cranks don't know anything. They're not smart like Rochelle Walensky or J.B. Pritzker. These two cranks, at Tufts and Johns Hopkins, the case against masks for children in the Wall Street Journal over the weekend. Do masks reduce COVID transmission in children? We can only find a single retrospective study on the question, and its results were inconclusive. Yet 2 weeks ago, the CDC sternly decreed that 56 million children and adolescents, vaccinated or not, should cover their faces regardless of the prevalence of infection in their community. They also said it doesn't do any harm. It's like preschool teach there, catchy in District 118 out Orland Way. Oh, everybody's happy. This isn't true. Some children are fine wearing a mask, but others struggle. In March, Ireland's Department of Health announced it won't require masks in schools because they, quote, may exacerbate anxiety or breathing difficulties for some students. The possible psychological harm of widespread masking is an even greater worry, the two doctors write. The adverse developmental effects of requiring masks for a few weeks are probably minor. We can't say that with any confidence when the practice stretches on for months or years, which is where we're at. Children have been known to transmit COVID, but far less often than adults. A North Carolina study conducted before vaccines were available found not a single case of student-to-teacher transmission when 90,000 students were in school. We've been encouraging Americans to wear masks since the beginning of this pandemic, write these two doctors. But special attention should be paid to the many children who struggle with masks, not according to preschool teacher in Orland Park. No problems here.
She's an expert.
Candace in Mount Pleasant.
Wait.
Wait. Candace, you're on. We can't wait.
We have the town hall article, but yet we're still talking about this. How many of these kids who get put in the hospital for respiratory issues or whatnot get tested for Legionnaires or something? I mean, the kids who are going to the hospital now with issues are because of the mask. But yet we're still saying, well, my daughter's a senior and she'll probably wear the mask. I don't get this. Why are conservative parents? I met a lady the other night at a GOP meeting, and she sent her daughter to the University of Nebraska, and she's got 3 roommates, and all 3 roommates got the shot, and these girls are pressuring this poor 21-year-old girl, and the 21-year-old girl now feels like she has to get the jab. And I said to the mother, I said, why would you let her get the jab? She already had it, which means if you make her get this jab or you don't educate her on it, she's going to get very sick with an autoimmune disease. What the hell is wrong with the GOP parents who cannot finally say, like Sean, your premise is wrong, we're not going to discuss it anymore, and my kid's not wearing a mask?
Well, thanks for the call, Candace. Sean can say that, and other people can say that, but then there's the situation of what are you going to do with your child? And by the way, that includes Sean's 2 girls that are college age now and are on the campus of, like, for example, University of Nebraska.
Well, one family that I know, they pulled their daughter from Creighton because Creighton, that Jesuit school.
Yeah, the Jesuits again.
In Omaha.
Right.
Yeah, they pulled their daughter from Creighton because Creighton was basically mandating the vaccine, and they put her at the University of Tennessee. Pulled her and put her there.
Well, I mean, that's what you can do. You can try to figure out where there are pockets of resistance, like there's pockets of resistance to DeSantis in Florida, but for some reason, the idea of resistance here, in reverse is unfathomable to people who otherwise should know better. Jeff in Cal City. Hey, Jeff.
Oh, good morning, Dan and Jeannie. Good morning, Dan and Jeannie. I just wanted to say, you had mentioned just a minute ago about the doctors, and they referenced one retrospective study that didn't show really any conclusive results. We're one of the most scientific-minded countries in the world. We do the most inane, obscure research. With this COVID crisis that's been going on for a year and a half, why don't we have hundreds and hundreds of studies about the efficiency and the effectiveness of masks and their effect on children? Why aren't there those studies out there?
There are studies.
No, there are. Yeah.
Thanks for the call, Jeff. But they're just ignored if they come up with the wrong result. I mean, there was a Duke University study that found that there was no impact in terms of reducing transmission with social distancing, which is never challenged. I'm reading from Tom Nicholson. I reported this earlier.
Yep.
He was a researcher at Duke, executive director of Advanced Access and Delivery. The Duke study, determined that social distancing had no measurable impact on transmissions, and it changed from minimal to very onerous distancing requirements. It was true not only in classrooms, but on the way to school. They concluded that having 1, 2, or 3 youngsters in a bus seat made no difference in transmission. Is anybody taking that to heart? Is anybody questioning whether or not we should be mandating social distancing? Everybody stand on their idiot circle at school? No, of course not. It doesn't matter. If the studies get the wrong answer for the politicians and the TV doctors, they're just ignored. You hear from them on this show. You may hear from them for 5 seconds on YouTube before somebody's taken down for referencing them. That's it.
And then already, Dan, businesses are responding. So you go to the grocery store. I know you don't, but I still am feeding kids. I do. And I'm telling you what, more people are masked up now. Before you'd see onesies, twosies. Now you're seeing half of the people are masked up and all the staff again. I mean, this is ridiculous.
Coming up at 6:36, we'll talk a little bit about this, but from an economic perspective, we'll also pour over the July jobs report with Jimmy Uriel, Fox Business Analyst. Now we check the headlines with Mike Scott.
71 degrees in Chicago at 6:30 on AM 560. The Answer. Good morning. I'm Mike Scott. Chicago police mourning the loss of one of its own. Officer Ella French was one of 2 officers and one suspect shot Saturday night. Chicago First Deputy Superintendent is Eric Carter.
During that traffic stop, the officers were fired upon. They returned fire. During that exchange of gunfire, 2 officers were struck. 1 offender was struck.